Hello, 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 everyone. Welcome to another episode of Sree's Daily Global COVID-19 Show. My name is Sree Sreenivasan, and it's my honor to gather this daily conversation around all things COVID. Today is a very special episode for multiple reasons. Number one reason, it's episode number 200. We've been live on the air for 200 days in a row. No weekends, no holidays, all through the pandemic in New York, 200 days, more than 6 months as we all come to grips with this global pandemic. We talk on this show about the health impact, the financial impact, and the national and international reckoning around race and inequality. Today, we have a very special guest. Dr. Bente Mikkelsen is with us. She's the director of the World Health Organization's Department for NCDs. Those are non-communicable diseases or chronic diseases. She's the former CEO of a Norwegian health authority with 70,000 employees and an $8 billion budget. And then she moved to WHO to run this department. She's been with WHO for more than 7 years. This is our 5th episode about WHO and its work. In episode 99, we met the WHO chief scientist and the director of pandemics. In episode 113, we met the WHO learning team. In episode 178, we learned how the WHO communicates. And in episode 175, we learned about mass gatherings. You'll meet Dr. Bente in just a minute. Hi, everyone. I'm Sree. Thank you so much for being here. Episode 200. I'm so happy to be here, to be with all of you. Thank you to every person who's ever wrote in to say this show is uplifting. This show is a lifeline. I want you to know this show is uplifting and a lifeline to me, for me. That's why I'm able to do this. And we're so grateful to everyone. I'm the Marshall Loeb Visiting Professor of Digital Innovation at Stony Brook School of Journalism and the co-founder of Digimentors, a social, digital, and virtual events consulting company. Our motto, don't cancel your physical event without talking to us. Don't even start planning your virtual event without talking to us. We do events for 50 people and we do events for 100,000 people. We bet your event is somewhere between those two numbers, and we'd love to talk to you about it. Thank you again for being here. You're seeing in our first 195 episodes, we've had 1 million plus viewers, 129 million social impressions, more than 347 guests, 202 of them have been women. We want to keep upping that ratio. Guests have been with us from 65 cities and 17 countries. We've had doctors, nurses, authors, journalists, CEOs, founders, teachers, professors, and you can find all our archives on youtube.com/Sreenet. And we are so grateful to our partners at Scroll Global and Scroll.in. Scroll.in is one of India's leading news, information, and culture websites. And we're able to do this because of our awesome sponsors, and we'll tell you about them in a little bit. And we're also able to do this because of our awesome producers, Rose Horowitz at Rose Horowitz 31 and Vandana Menon, Vandana_Menon. We have been on an amazing journey for 200 days, and I'm so grateful to them as well. Now, are you ready to talk about the COVID situation and what it means for chronic diseases and other aspects of the crisis? I know I am, and I'm looking forward to your comments and your questions. Our guest again is Dr. Bente Mikkelsen, who is the director of WHO's Department for NCDs, or non-communicable diseases, chronic diseases as they are called. And now I am honored to have her on the show with us. Hello, doctor.
Hello. Very nice to see you. Thank you for having me today.
Thank you for being here. My first question always, how are you? Where are you? And how is your family handling the pandemic?
Thank you for these questions. So I'm at home in Geneva, and I am very blessed and very, I know that I'm lucky because I'm in a country that has really good health coverage and a lot of structure. And I am, like many other people, separated from my family, which is really sad. And maybe, it's mixed feelings on the Saturday. And so if I should mention one more thing is sort of the balance that we have, the separation of family, the challenging time. But then this week I just came out of 4 days with a lot of stakeholders wanting to do everything to support diabetes in the world. So, this is life, isn't it?
It is. This is the new world that we live in, and I'm glad that your family's doing okay. But you're away from them. You're from Norway, and we will talk about your work, your career. We'll talk a little bit about what it's like to run a big health authority in Norway, on Norway's biggest, and about the work you're doing. I just wanted to start with this observation that you're in charge of non-communicable diseases at a moment when everybody's only thinking about communicable diseases, and one particularly communicable disease. So if you can put that in context for us, what is a connection between COVID and chronic diseases? What are the things that we all need to know? That would be a great start.
Thank you for asking this question. So, at the moment, of course, everybody wants to defeat COVID-19. So I think everybody is focused on that, and that is really a communicable diseases. And it might be to some surprise that actually this situation is like an X-ray. So it's an X-ray showing the situation for the non-communicable diseases. And non-communicable diseases is, as you say, it's the chronic diseases, it's the heart diseases, cancer, diabetes, and lung diseases. And just to add a little bit more on them, because I think people don't necessarily know everything. So these are the big killers, has been and is still. So 42 million people die before the age of 70 under usual circumstances of these 4 diseases. So my normal work, business as usual for me, is to really fight these diseases by reducing all the possible risk factors like alcohol, tobacco, trying to make people more healthy, eat more healthy food, and do more exercise, and then to reduce the deaths too early of these 4 diseases. So that's my usual work. But as I said, the COVID has been like an X-ray. And, I think still people don't realize, normal people don't, or sort of not normal, but people that are, not in healthcare don't really realize that it is these people living with diabetes, with heart diseases, with cancer and lung diseases that are most at risk during COVID. So those people get more ill, more severely ill, and those are also the people that die from COVID. And also because the health system has now taken care of COVID, it's also a big disruption for these people. So when they usually go to hospital to check their blood pressure or to get their insulin doses adjusted, or maybe they need rehabilitation after a lung disease, these health services is unfortunately now disrupted, so people cannot get these services anymore. And we see people that should have been diagnosed with cancer under usual circumstances, they cannot access hospitals. So my job at the moment is really to build back better and learn from this pandemic and, accelerate the work we already had started to reduce the fact that people are dying too young from these 4 diseases. So that's my daily life, my daily work at the moment.
God bless you for doing that on behalf of all of us. Can you just remind us of the 4? Because I know there are people listening right now who have family members who are affected by those 4. So I want them to hear that.
Mm-hmm. So, usually when I'm giving a lecture or is with a group of people, I usually ask people, could you please raise your hand if you have an NCD? And then very few people raise their hand because they don't really know the 4 diseases. So that's typical. But the 4 diseases is the heart diseases, the cardiovascular diseases, it is cancer, it is diabetes, and it's lung diseases. And then if I ask the question again, I'm sure all of the listeners as well, if you raise your hand, do you have yourself one of these diseases, or are any in your family impacted? They will have to raise their hand. Me too.
Yeah, and that is so sad because it is such a big part of our lives. Those 4 diseases affect so many people. What is your estimate of the number of people in the world who are affected by those 4 collectively?
So 42 million dies every year and from non-communicable diseases. So that means it's approximately 72% of all the deaths in the world is from these 4 diseases. But the most important is that, most people or the people are dying too young. So they are dying before 70 years of age. So, and many people think that this is only diseases of the affluent, the wealthy, the Scandinavians, whatever. That is not true either, unfortunately. So this is also a very high toll. 3/4 of these people dying too young from NCDs, from heart and diabetes and cancer and respiratory diseases, are living in the low and middle income countries. So it's yet another very, very big challenge for these people.
And so much, another reason why everybody needs to pay attention to this topic and understand what is happening. Let's talk about how you are set up at the WHO. What is the NCDs department? How long has it been around? You've been there for 7 years. How many people work in NCDs, and the structure, please?
Okay, so I think I will say that I'm working in Geneva, and I worked also 2 years in Denmark, which is one of the regional offices. So WHO is a global organization. So in Geneva we have a headquarters, and then we have 6 regional offices, and this is the way we cover the whole world. And in 134 of the countries, we also have a country office. So this is important because our focus is not to work in Geneva, but to work in countries that need our support. So when you ask how many people are working on NCD, that is actually a bit of a difficult question to answer. But I can tell you that we have several departments that are supporting the work on NCD in Geneva. And then we have people in each of the regional offices working on this, and at country level as well. And the good thing is that during a pandemic like this, for example, we meet every week with those responsible for the work on NCD and COVID from all the regions. So we know what is the need of the countries, because that will, naturally shift as they go through the phases of the pandemic. So it's very important. After Dr. Tedros came as a Director General, we are very, very eager to really work all of us together as one team, and with the focus on what is happening in the countries. So if you go to our websites, and you should do, because it's a lot of good news there as well. We are in a very challenging situation, but you will see that, we have experiences from Moldova, from Portugal, from India, and so on how people now are working together, civil society partners and the country offices to really fight NCDs. So this is at least one answer to your question. I think that's the most important answer, because the number is not so important, because even if we are small teams all over the world, we work very closely we have, for example, collaborating centers, 800 of them, which is scientific support. We work very closely with civil society and NGOs. So, for example, a couple of weeks ago, NCD Alliance had a full week of how to act now on NCD during COVID. So this is extremely important. So we are a huge sort of community. That said, if you look at business as usual, if we were not in the pandemic, it has been, unfortunately, a chronic underinvestment in the area of NCD. And that is why when I sort of started off saying that the pandemic is like an X-ray, so it makes us see all the fragility in the countries that should have been much stronger, much more protective for their people. That is because NCD hasn't been given the priority that it needs to have, both for the prevention, to protect, but also to manage NCD. So we are sort of trying to use this situation of the COVID to build back better. We need to learn from what we see and to speed up really to make the health systems respond to NCD in all countries and focus to reduce, tobacco, alcohol, increase the physical activity, and provide people with more healthy diets. So that's what we are doing. Thank you for giving the key facts, and you can also find a lot of information on COVID, because you know that during COVID, I'm sure you have discussed this, Sree, in your other series as well, that it is a lot of myths and disinformation. And we know that one source that you can trust is WHO, and we have a lot of information. So you can, if you go to the COVID webpage from WHO, both individuals, health workers, healthcare workers, and the governments will be able to find very useful information on how to protect yourself, what is the most important thing to do if you're ill, if you have a relative that get ill, and so on and so forth. That is very important. Information is very important. When we asked all the member states in May, because we had healthcare workers and patients actually starting to really ring the alarm bell and say, listen, what is happening during COVID for heart patients and people suffering from cancer is very dramatic. You have to check this. Okay, so we checked it. We sent out a survey, and we asked all the 194 member states of WHO to give us information. And it was very busy times because it was in the beginning of the pandemic. And even so, 80% of them answered our survey. That was very important. So that's why we know that, the services for cancer, diabetes is disrupted in 50% of the countries. We know why it's disrupted. It's very often because people have changed their health-seeking behavior, so they don't come to hospital anymore. It's because of lockdown of transport. Unfortunately, it's also because they cannot get the medicines that they usually use for their hypertension, or even worse, for insulin to help diabetes. So this is really dramatic. So this is what we got to know. And I know you want to maybe ask me to stop it. I have to tell one more thing, because you told me before the interview that it's also important with good news. And I think we know that we can build back better, because part of this survey also told us how they mitigated. What did governments do to really help people with NCD? And what we could see that almost all the countries had started to use telemedicine, and they use digital health solutions. And this is something we wanted to see happen for years, and in the last 5-6 months, suddenly everybody was starting to do that. And also completely new ways of doing things, task shifting. People were really into sort of other ways of dealing with community level healthcare workers started to support patients. There were new ways of distributing medicines. You had private sector coming in with donations of insulin, for example. So suddenly a lot of solutions also came around, which we of course want to learn from and bring into the building back better, helping people, support people and protect people, I would say, so they are diagnosed, so they are treated, and so they are taken care of.
Well, thank you so much. Folks, you're watching a conversation with Dr. Bente Mikkelsen, who is the head of chronic diseases at the World Health Organization. And this is our 200th episode. You'll have a chance to ask her anything you like. Please post in the comments. We see lots of comments coming in. Please tag your friends. People who care about cancers, also about lung diseases, heart diseases, and diabetes. Those are the 4 big chronic diseases that Dr. Bente pays attention to and helps the world understand and also deal with them. So please ask your questions. She mentioned misinformation, disinformation. Those are part of the problem. That's a chronic disease now in the world, and we are fighting that on this show and in other places. Please follow her on Twitter. She is Mikkelsen, BENTE_, and you can find her on Twitter, and please follow her and tag her and tag your friends as well. Let's look at some of the comments that have been coming in, Doctor. Jonathan's watching from the East Village in New York. He has watched for 200 episodes in a row every single day. So we're so grateful to Jonathan, and thank you for your support, Jonathan. What is your favorite memory of New York, Doctor?
Oh, actually, I have to say that one of the most dear memories is to be in the UN building in 2018, when all the heads of states and governments were making decisions on NCD. You know, there is nothing similar. When you see all these nations coming together, they understand this is the challenge of the 21st century. And they decided that in addition to the 4 diseases we have discussed so far, they also wanted to improve and focus on mental health as a 5th disease, and also on air pollution. And seeing all this, listening to them, it's like I can't explain. You get sort of goosebumps, because it means a lot when the presidents and heads of states are coming together and deciding these kind of things. We couldn't in the UN do what we do now without that support. And I think people around the world, from the small villages to the big cities like New York, they can really feel this power coming out of a meeting like that. So that's my first and foremost memory, and of course a lot of good foods, friend, and so on. But but from the professional side, that was a very, very special moment.
This is that meeting you're talking about. There was a July and a September meeting in New York, and so you might be in one of these pictures. We can't tell, but you might be here. So this is important. So let's keep going. Linda is watching from misty Long Island. Good morning, Linda. Thank you for being here. Doug is watching from California. That means it's 6 in the morning for him. Thank you, Doug, for being here. Doug is an expert on how to communicate during a crisis like this. He has written a book about coronavirus. In the first 100 days, he wrote a book. Maybe first 2 months, he wrote a book about this. And we're also worried about California because of the forest fires and the issues around that. Do you find, Doctor, that these chronic diseases become worse in this pollution and fires and all of those issues that come about too?
Yes, of course, you know, the fires is part of the air pollution. So we know air pollution has a big impact on lung diseases and also premature deaths. And that's also why, you know, the heads of states and government decided air pollution has to be also seen among the risk factors for lung diseases and lung cancer among them. So, of course, and, you know, this is also, we have many things that, you know, everything is more or less interconnected. And that's also another event in the UN building in New York when you know, the Sustainable Development Goals were decided in 2015. And one of the goals was about reducing the non-communicable disease premature deaths, meaning dying before 70 years of age, with 30% before 2030. And if you look at all the goals, the beauty about these goals is that everything is interconnected. So, you know, environmental causes, economic, you were mentioning gender equity, all of this is impacting. And we can see that coming through absolutely everywhere. I think one thing that is coming out of the COVID is that before some people were thinking that, you know, health is a special issue, so we can talk about economy, we can talk about environment, and then we can have another meeting speaking about health. I am sure that now everybody knows, because of the lockdowns, because of the immediate effect on people's livelihood, well-being, everything, that health is actually the center of the SDGs. So we cannot be able to be seeing sustainable development without really fighting the NCDs and supporting this. And I think this is new, and that makes me happy in a sense. It's a very, very heavy toll. And as I started, we defeat COVID-19 now, but we cannot actually protect ourselves for the next pandemic without focusing on health and the chronic diseases in between them.
I think it's very important that you said next pandemic, because this is not a one-time event. We're not done with this second wave, third wave, but there will be other pandemics, and we are not ready. And that's part of the problem. Nimish says hello, and Nimish says hello, Dr. Bente. And Rick says, congrats on 200 without a break. Insane, from Charlotte, North Carolina. And we have a question for you. Thank you for this. What type of illnesses have been mostly affected by this virus? So of those chronic diseases, which have been most affected by COVID? Either maybe you can talk about two aspects. Ones that are directly impacted because how COVID is that underlying condition, that more the comorbidity, as we say, and also because of the attention taken away by COVID, which diseases have been hurt the most. So if you can address,
yes.
Thank you.
Yes. So we very early on, most of the affected countries started to publish, the relationship between NCDs and other diseases and COVID. So, for example, one of the first publications was from Italy, where we saw that people dying from COVID in the hospitals. Out of these people dying, 67% of the people had hypertension, and 30% had diabetes. And we have the same kind of figures from Australia, from Mexico, and we are now at WHO also pulling all this together so we can give a global answer. But there is no question, it is, especially the heart diseases and diabetes. And we can see that, people that are smoking, having these risk factors, are more at risk for getting really severely ill and unfortunately die. So we don't know what is the, excess morbidity, from COVID. So the question is, how many more people die now from NCD during COVID than usual? We cannot give you the global number, but we have enough figures to know that this is really at high risk. So meaning that the people having these diseases, what we call comorbidities, those who have heart diseases, lung diseases, cancer and diabetes, are more at risk to getting severely ill and die from COVID. So that's number one finding. And then the second finding is that when we got answers from 80% of our member states, meaning 163 countries, we could see that in 50% of the countries you have this very, very severe disruption. What that means, the access to essential healthcare is not in place fully or at all. So when we looked at that, especially this was impacting people with heart disease, diabetes and cancer. So these were really, really affected. So I'm sure you know from your own families and friends that you have had people not getting their medicines, not getting into hospital, and not getting the same early diagnosis for cancer that we usually have. So this is really, this is of a big concern, and that's why we are so eager to, be together with all the different regions every week. We have developed also all together with all programs in WHO guidance, how can we, in a situation like that, how can we close these gaps as quick as possible, and how can we rebuild, the system after the pandemic? How can we take care of what you can see as the backlog, all these people waiting? So we have been using words of a deadly interplay. So in the situation like pandemic, it's like an X-ray. So the situation before pandemic was not totally, or it was not in place. And when the pandemic came, it was even getting worse. So it was underdiagnosed, untreated, and you could say unprotected people. So another thing we are very eager to see is, in a crisis like this is an emergency, it's a humanitarian crisis, and we have systems in place in all countries, what we call preparedness and response plans. And when we looked into these plans, they didn't really include chronic diseases and NCD. So that is another thing we have been working on, really trying to get all the countries to include it into their plans as well. That is important.
Thank you. We're looking at a section here about mental health and chronic diseases. Can you talk a little bit about that, and what are we seeing here? It says what governments can do, what people can do, and we'd love to hear your thoughts on that. It says that people can follow medical advice, stay physically active, get vaccinated, breastfeed when it's relevant, what governments can do to promote health, and what are the benefits. So please talk about this.
One of the first thing that was really also addressed, and it's my colleague, Dr. Deborah Kestrel, that is responsible for this in WHO, and maybe you could invite her next time to speak more about this. I think what is super great, what they did very early on, they actually made a cartoon, a picture book for children to help them to stay mentally fit during a pandemic, because being a child is even more challenging probably than being a grown-up. So, but it's very typical. What we do is we issue guidance for the individual, for the population, for healthcare workers, for governments, together, because we need to give a little bit of different messages to all of them. So obviously this is important. And I could also add that is also why we are very, very eager to give clear messages on alcohol, because as you know, it is a high level of stress in a pandemic like this. I am sure you also have experienced this. For example, a couple of days ago, one of my best friends' mother died. He were not able to go home and say a last goodbye to her, and he will probably not even be able to attend her funeral. And this is really, really heavy for people. I spoke with an Indian colleague yesterday. They were not able to assemble all the people and really do the farewell to another relative. So this is only examples to say that mental stress level is very, very high. So then if people in addition use alcohol, which is a psychotoxic substance, it can even get worse. So I think what you're saying is very important, that in a situation like this, it's even more important than usual to focus both on mental health and well-being, and also to reduce all the risk factors, tobacco, alcohol. Even if you're at home in a small confined apartment, you should try to be physically active, and you should also try as much as you can to eat healthy.
Great advice under any circumstances, but especially now. Folks, please tag and share your friends as we are talking to Dr. Bente Mikkelsen. You can find her on Twitter, Mikkelsen Bente, BENTE _. Please do follow her and please connect with her, and please tell your friends, ask questions. What we're going to do now is I'm going to take a couple of questions that have come in, with so many that have come in, Doctor, and then we're going to take a little bit of a break to just give her a chance to catch her breath, and also to share this on Twitter with her friends and to tag her friends. And then after that, we'll come back to her and finish the show. We are so grateful to her for her time, and to all of you. We're on episode 200, everybody. Thank you for your support in making this show what it is today. There's a question here. I'm going to ask you this question here from Alvaro. Alvaro Martin says, will more people die from chronic conditions because of COVID-19? You mentioned 42 million people die every year. Will this increase, is the question.
Mm-hmm. So we don't have the figures yet, but there is little reason to believe that it's without doubt that we will have an increase. I cannot tell you how much, and these are things that we are now trying to pull together in WHO, both with exact data, but also through modeling. So we expect an increase in deaths from NCD during COVID. And then, of course, in addition, you have the additional deaths that are coming from COVID. So that is what I would say, expect and fear. Yes.
Okay. Thank you for that. And we're going to take a little break just to thank our donors and sponsors. And we'll let Dr. Bente catch her breath and maybe have a glass of water. And thank you very much, Dr. Bente. Folks, please tag your friends right now and please share this with your friends and family so that they can watch this very important conversation. I know I'm learning a lot. And part of what we do here on the weekends is we have multiple shows and we want to tell you about them. On Sunday morning, we start with the New York Times read-along at 8:30 a.m. every Sunday. It's been 5 years this October that we will have been on the air reading the New York Times out loud on Facebook Live and all the other channels. This week, we have a very special guest. Lori White is the president of the Greater Providence Chamber of Commerce, Rhode Island's largest private sector business advocacy and economic development organization. So she'll be here at 8:30 a.m. We'll read the New York Times together, and that's always fun. We also have at 11 a.m. Eastern a medical show. She's on call with two fabulous doctors, Dr. Sujana Chandrasekhar and Dr. Marina Kurian, two surgeons in New York, friends from high school, and also my friends. And I'm honored to be co-executive producer of the show. And they have an OBGYN, Dr. Camille Clare, and an infectious diseases doctor, Lillian Abo, will be with them at 11 a.m. on Sunday. So 8:30 to 10:30 is the New York Times read-along, and then she's on call. And then we will have the 201st episode of this show, which will be tomorrow night, Sunday night, and you'll meet Michael Schmidt of the New York Times, who is known for breaking global stories on a regular basis. He's the best-selling author of the new book, Donald Trump versus the United States, Inside the Struggle to Stop a President. That's 9 p.m. Eastern time tomorrow, episode 201. It's still hard for me to think in the 200 numbers, but here we are. And for that, we have to thank all of you and to thank our wonderful sponsors. We want to thank The Inventor in You, a step-by-step guide to your first invention by Charles Cunnincarroll, developer of more than 80 patents at Inventor Charles and guidetoinvention.com. We also want to thank nonbelievable.com, divinely delicious cookies on a mission. Each handcrafted cookie provides a meal to those in need. One cookie, one meal. 20% off with the code SREE. Please check them out. Please support them. We also want to thank our friends at Muckrack Academy. They helped me put together Fundamentals of Social Media, a free, on-demand certification course that gives you the fundamentals of Facebook, Twitter, Instagram, and LinkedIn. And more than 4,000 people have taken the course, and so should you. Here are just some of the certificates that people have gotten and very nice comments from around the world. We're so grateful to Anka and Edem and everyone who's finished the course and said nice things. mrac.co/social. I am again so grateful to everybody, our sponsors, our producers, Rose and Vandana, and to all of you. We wouldn't have a 200th episode. We wouldn't have a 5th episode without all of you. So thank you for being here and thank you for supporting us. Our entire archive is on youtube.com/Sreenet, SREENET. You can just hit subscribe and grab that get an alert every time we're live on these shows, including the New York Times read along. Also want to tell you that we have a very gentle WhatsApp alert that you can get. So if you just hold up your phone right now, and you will be able to get an alert. This is not a WhatsApp group. It is just an alert that you can get when we are live. So please do hold up your phone and grab that QR code so you can get an alert when we are live. Also on Sundays, our friend Stefan Kaplan has a show that airs right after this, and you can check that out. It's called the Spin It Social Hour. Let's talk photography and social media every Saturday at 10 a.m. at Spin It Social. Travel enthusiasts and photographers Hallie and Jim Soul are with him today at 10 a.m. Eastern. So thank you all, and I think we're ready to bring back Dr. Mikkelsen, who has been so great and very generous with her time today. We have lots of comments coming in, and we'll try to get to all of them. So let me welcome back on stage Dr. Mikkelsen. Thank you, Doctor, for being here. I want to say that your background is as an OBGYN. And tell us how you decided to go into medicine. Tell us about your childhood in Norway. Where did you grow up? And how did you decide that medicine was a life for you?
Oh, that's great questions, huh? So I grew up in a small industrial town south of the capital of Norway called Oslo. And, well, I don't know, I wanted to do something, real. I wanted to add value to people's life. I always engaged, in, I would say, changing things, changing the world. And I thought medicine was a great way to get into that. And actually, before I studied medicine, I was also doing sociology. And I think that helped, to understand sort of how much equity means, how social determinants also is important for all kind of health and life, meaning that you have to give access to education, you have to have a sort of a minimum level of income, all of these things. So, and then, I think life is nice. So if you just say yes to opportunities, you will always experience new things, and there are always people around that want to guide you, support you, and so on. So I used a lot of my time as well in the medical association in Norway, trying to influence the policymakers and so on. And, to some extent, we succeeded as well. And then I was doing gynecology and obstetrics for many years. And then I was asked to support a new hospital, what do you call it? A big change in the Norwegian healthcare system, and that's why I became the CEO of a regional health authority that took care of half the Norwegian healthcare. So that was a tremendous experience that we were really able to, I think, change a lot in the hospitals, but also in communities and so on. So, and I think then all of this brought me to my attention, the huge work of WHO, and then I was asked to join WHO, and that was a fantastic experience. So, last 7 years, together with colleagues around the whole world, sometimes you can get impatient that you want to see things move quicker. It's easy to actually be in a labor room and support a mother and a child coming to birth and changing things all around the world. But it is really, really a fantastic opportunity. I'm super humble.
And here we're looking at your Twitter feed, and it says Director of WHO's Department for NCDs, proud to work with WHO on next-gen NCD hashtag agenda to build back better, beyond recovery, towards hashtag HLM4 in 2025. So tell us HLM4.
That's a lot of acronyms. Sorry about that. But, some of you know that most of the big decisions are really happening in New York during UN General Assembly. So that happens now and then. And it's very few health issues that has been on their table. And of course, the first one was HIV/AIDS. And then the second one was non-communicable diseases, heart, lung, diabetes, and cancer diseases. And this was, of course, because these are the diseases that kills most people in the world. So it accounts for 72% of all deaths. So that has happened then in 2011, 2014, 2018, where all the heads of states and governments are coming together, and they make very important decisions about health and NCD. So when I'm saying here HLM 2025, it's the next high-level meeting that will discuss NCD, and that will happen in 2025. And that is an opportunity for us to renew the agenda. So we have, you have seen maybe that we have been focusing very much on the productive years in a life course, meaning from 30 to 70 years of age. But we now want to also focus on children, even before they are born, prenatally, and through the whole life course, because many of the things that is influencing on non-communicable diseases starts with the health of the mother carrying the child, and of course as well the early years in childhood, where the nutrition you get, or if you're exposed to secondary smoking, or how healthy the whole environment, are you exposed to air pollution? All of these things are really detrimental factors to shape, the health of the child. And even more when you go into adolescence years. Of course, you can imagine in the world we live in, we are bombarded, unfortunately, by misinformation and negative influence on unhealthy factors, sugary drinks, tobacco, alcohol, and all that. It's really, really hard to be a young person today and be health literate enough to take the right choices. So what I'm hoping for is that the next high-level meeting on NCD will focus on the whole life course, but also very much on what we are seeing now during COVID, that we have to include NCD fully into what we call universal health coverage, meaning that these kind of services that is needed for people with heart, diabetes, cancer, and respiratory diseases has to be provided by the government, so that people with these diseases can be sure that they get their medication, that they are, they have access to healthcare personnel in their community, in their primary healthcare services or in hospitals, and that they can get treatment and also diagnosis for cancers. And this is very important, as you know, I started the interview today to tell you that today when I'm sitting here on a Saturday, there are many things, so you have mixed feelings, but one of the good things that I brought into my weekend was a fantastic 4 days meeting we organized together with colleagues in Geneva HQ, in WHO and from the regions, focusing on diabetes. And just to think about that, it's almost 100 years since we got insulin, which we know is a super efficient and extremely important medication. And only 50% of the people that need insulin has access at all. And when you go into a crisis like this, or in humanitarian settings, it's even fewer people that get insulin. So, of course, there is no excuse why not everybody that need insulin should get insulin. So this is a typical example of an essential health service that we need to include into the universal health coverage. So in the new agenda of the NCD, I hope that universal health coverage will be more clear, that it is services for people at the community level, that it's in the primary health care, that doctors and nurses are trained to really take care of the people living with non-communicable diseases. So that's why I have the hashtag Next Generation NCD. But these are things that we will discuss for the next coming years together with colleagues. And it's not only my thoughts, we need to be all together with all stakeholders and partners to develop this agenda.
Thank you so much. Peggy is saying hello from Taiwan. And we have Rochelle watching from Hastings on Hudson. Pradnya is watching from Silver Spring, Maryland. She's been tagging a lot of friends. Rick is saying chronic diseases, unhealthy lifestyles, and COVID are a toxic combination. And Makrand is talking about the Indo-US Corona cooperation. Pradnya is tagging various friends. Thank you, folks. Just do this. Just tag your friends so they can learn. And there's a question here from Nimish about COVID-19 and is WHO's messaging, what are you going to do to tell people that this is not over and there's still so much to go? And how will people understand that? He's saying that in India, people are taking it casually, are starting to take it casually. Is it the messaging that it's a long-term thing? Does it help people kind of bear down and work harder? Or does it make them say, oh, this is long-term, so I have no hope anyway? How do you balance that, doctor?
Mm-hmm. So I hope that you look at press conferences that is happening 2 or 3 times a week with Dr. Tedros, the Director General of WHO, and he has, Maria von Kerkhove and Mike Ryan with him almost every time. And they are those who are leading on the COVID work per se. And I think when you listen to them, you will learn that it is extremely important that we continue to do the very, very simple but extremely efficient things that we have been asked to do, each and all of us, all the time. And that is to wash your hands. And in a sense, this should never go away because this is what we always should do. So frequent hand washing and using hand sanitizers is extremely important. And then it's the meter that we have to take into account. And then, of course, we have to use the mask when it's necessary and really to be able and also to seek advice and healthcare when we need, and when we are ill, there are a lot of specific guidance. So please do these very, very few but extremely important things, and we shouldn't start letting loose because you can see in many countries now it's coming back. They thought they were done with the whole thing, and then it's coming back. You can see when students come back to campus, it's suddenly a peak, big, private events or official events and so on. It's really, really tough.
And so are you feeling hopeful or less hopeful than 3 months ago?
So I think we just can say that we are working hard, but there are parts of the world that is very much affected, and we are working hard to get to the sort of the situation where we have an effective vaccine. So I wouldn't be the one to ask, to give a prognosis. So I think I will focus on please let us prevent and do what each and one of us can do to support the whole of society.
That's beautifully put. Let's go to a couple more questions. I know you have your Saturday. What are you doing on the rest of your Saturday? It's Saturday already 4:00 over there. What are you doing this weekend?
So I'm going for a walk with a friend and her dog, which is great. And then I have a nice dinner with another friend. So my Saturday looks very, very nice. So it's a combination of being outside, physically active, having a little bit time off from work and seeing some good friends. I think that's the best way to keep your mental health, right?
You're absolutely right. I tell folks our dog forces us to go out. Otherwise, we would not be going out as much. Even a little amount that we do go out. I do want to ask you, Doctor. There are people who are watching right now who are kind of horrified at the situation America is in, a country that has 5% of the world's population and has 20%, 25% of the COVID deaths here. What can you tell us about what you understand about the American health system that has resulted in the situation? Coming from Norway, that Americans are often critical of socialized medicine. And you ran a big Norwegian health agency that took care of its people in a different way from America. So in America, we're very proud of our health system. But what are the problems or systemic problems that COVID has revealed to the world? And I know there's also a geopolitical fight that the president has taken on by himself against WHO. So we don't want to get into that. But what is your understanding of the American healthcare system? And for those skeptical of socialized medicine, what you're getting in Norway, in the Scandinavian countries that we don't have here, and you have a different outcome than what we have here?
I need to find the charger, because otherwise you lose me in 2 seconds. Yeah. Maybe you can continue.
Yeah. Thank you, Doctor. Folks, we're talking to Dr. Bente Mikkelsen, and I'm so grateful to her. You're watching right now. These are the books of just some of the books of the interviews we have done in these last 200 episodes. We interviewed Natalie Nixon and her book, The Creativity Leap. We interviewed Cornelia Dean, the New York Times science editor, on her book, Making Sense of Science, that was on our New York Times read-along. The Socrates Express by Eric Weiner was a great interview. He's former India bureau chief for NPR in American radio, National Public Radio. Primitive, a book by Marco Greenberg about how you can unleash the power of your primitive brain. Hate Monger, you can guess who this is about. Stephen Miller, Donald Trump, and the Fight Against Immigration by Jean Guerrero. Hypereducation by Pavan Dhingra. Why Good Schools, Good Grades, and Good Behavior Are Not Enough. The Inventor in You by Charles Cunnincarroll, about how you can be an inventor even if you've never invented anything. You Next, about a book about Black barbershop culture in America by Antonio Johnson. Baljinder Kaur and Simranjeet Singh. Fauja Singh Keeps Going is a picture book for children about the world's oldest marathoner, and is really a celebration of multicultural and diversity. And New York Street Portraiture by Kurt Boone, who is a poet, journalist, bike messenger, and photographer. And he was been on our show twice, once about 9/11 and the other to talk about empty New York, and showed us these stunning photographs of an empty New York City. We are going to bring Dr. Bente on for just a few more minutes. She's been so kind to spend time with her. We want to tell you about this very important event that's coming up Saturday, October 10th, the Impact Summit, which is going to feature 4 of the Indian American congressional delegation: Ami Berry from California, Pramila Jayapal from Washington, Ro Khanna from California, and Raja Krishnamurthy from Illinois. And they will all be with us. Vanita Gupta, one of the great civil rights leaders in America, and a former member of high-ranking Department of Justice official. Those are just some of the names for a 3-hour incredible free workshops and conversations that you can watch. And it's iaimpact.org/summit. iaimpact.org. You see the address at the bottom right, iaimpact.org/summit, and you can get your free tickets. People can watch all over the world 2 Saturdays from now, October 10th, from 1 to 4 p.m. And with that, we're going to bring back on stage our special guest, who has been so informative and so helpful to all of us here today. We're going to go back to talking to Bente Mikkelsen, Dr. Bente Mikkelsen, who is an OBGYN and head of communicable diseases, non-communicable diseases, and chronic diseases at WHO. So my question to you, Doc, was about the U.S. medical system. What are you comfortable talking about? I know you don't want to criticize the physicians and the doctors, but about the system itself. What is the difference between the Norwegian system you ran and the misunderstandings about socialized medicine, and therefore a completely different system we have in America?
So, at WHO, we support all the member states with guidance and advice. It could be both on the specific diseases like cancer, childhood cancer, and diabetes. And we also give guidance and advice on health system and how they are financed and how they are structured and so on. These are advices that goes to the government, to the Minister of Health usually, and it's really up to each and one of the countries how they will, both use the advice, how they will adapt, and so on. And the other thing we do surveys and surveillance as well, and monitoring of systems. And then we give feedback if we can see that some countries, they have chosen a specific way of doing things and that doesn't really profit health, or we can see that it's too much out-of-pocket payment, patients pay themselves and so on. So I'm just saying that, I think it is difficult to give any sort of specific judgment of any of the countries. We have seen that many countries have chosen different paths through the pandemic. Sweden was very different from Norway. You have India does it differently from Singapore, and so on and so forth. So I think honestly that I know that healthcare workers all over the US has been working super hard during the pandemic. It has been detrimental situations in some parts of the US, as we have seen in other countries, and I'm hopeful and sure that also in the US there will be a review on how this pandemic was sort of managed and how could be the learning point and the way to go forward. I think that is what I can say. And we will, of course, learn from both the things that has gone well, but also the things that hasn't gone so well. And we will continue to give the support and advice to every country that asks WHO for support and guidance.
Thank you. And I do want to point out that you are really great on Twitter. And while we were talking, you were doing a lot of tweets. So everyone, please follow Dr. Mikkelsen. You can find her on Twitter at Mikkelsen Bente _. So you can see the spelling right on your screen. Please follow her. And we have just a few more questions very quickly. One of the questions is, how do you make sure that NCDs and chronic diseases are at the top of the World Health Agenda in the next 5 years? What are you doing and what can we do to help people understand that?
No, I think what we are doing now is we are really trying to get the information, the facts out. And this is what I've been doing now the last months. I am sort of very vocal, as you will see if you follow my Twitter feed, on what is the situation that, we see. And I think it's very important for the patients as well, those living with the diseases, that they know that WHO see how much suffering is actually affecting them during the COVID. So that's the first thing, to really make the decision makers see that they have to include NCD in the situation we are just in now while we are defeating COVID as well. But even more important is that, we have a lot of tools that is available in WHO for fighting NCD. So actually, there is no excuse. Every country knows exactly what to do. And the other thing is that we have talked about the UN General Assembly a couple of times during the interview. So there is a lot of political commitment. So that at the highest level, there is no question. The government, the heads of states of government know that they have to do something to tackle NCD and to fight NCD. And we need to now get that into action. So it's really protecting and supporting people. So I think that the constant sort of information, advocacy, also working with partners like this week, 4 days on access to insulin, together with partners, really get the message out is extremely important. So that's why I'm so happy to be with you today. And I'm extremely impressed of the 200 days and the 200th episode. And I think this is also very helpful. So I will also say that not only follow the Twitter, we need also people to stand up, to tell their story, to ask for support from WHO and support the actions that is needed. And of course, this is unfortunately not without a cost. There has to be an investment. There has to be an investment in capacity building in the way we organize our healthcare services. But I can promise you that this investment will give a high return of investment, because just imagine that if we could have more people living beyond 70 years of age and contributing to society, that is a tremendous gain for the society. So it's a small investment, and so far it has been an underinvestment, and this is what we need to do. We need to invest to protect and prevent people for NCD. And many of these things are for free. Quitting smoking is actually totally for free. You will even have some return of your own in your own pocket,
Yeah.
So this is things that we all can do.
When I was growing up, 70 seemed very old, but this month in October, I turned 50. Suddenly 70 is very close. So
Yes.
I am very aware of this. And so you're saying that your goal is to help those 42 million people who will unfortunately be lost because of these chronic diseases. And what can we do?
I think, if you see what Dr. Tedros said the other day, he is a strong supporter, of course, of this agenda, and he had a quote. I think I actually have it just here, and he said, NCD are changing the world. The fact that they have become the leading cause of deaths in most countries is worrying. And remember, this is very much happening in the lowest and low-income countries. It's really the diseases of the poorest million of people. We have witnessed 200 million deaths from NCD among women and men aged 30 to 70 during the last 20 years. And he continues, we will see another 150 million premature deaths from NCD during the next 10 years, but we can still turn the tide. We must build back better so that most of these deaths can be delayed or avoided. And I think he says this very beautifully. And it is possible because we have the tools. It is possible because the investment is small, but it has to come. And the return of investment is tremendous.
Thank you very much. I think before we let you go, we have two questions. One is, Tanush has been asking this multiple times, so I'm going to put this question to you. I know you don't have the answer. No one has the answer. But what do you say when people ask like this? How will this end? When will this end? I'm tired. I'm in pain of the lockdown, isolation. What do you say to people like that?
I say that we have to be hopeful, that we just have to accept the fact that we are not done, that we have to appreciate all the people that are working around the clock to try to find a vaccine. And we have to do what we can do, each and one of us, staying healthy, quit smoking, reduce the amount of alcohol, be physically active, and also eat healthy food, wash your hands, keep the meter, and use the mask when you need to.
The mask is so important. We have the head of the CDC say that masks might be even more important than vaccines in terms of just immediately having an impact. And that's something we're thinking about. Rick Botello asks, does Bente do any work with WONCA, the World Organizations of Family Doctors? What an unusual acronym, WONCA.
Yes. No, they are a very important partner of us because, these are the guys that see the patients the first time, most of the time. They are the family doctors, so they are extremely important. And I think sometimes they are not being seen as the front workers in a pandemic. Actually, they are, and I think we need to engage them even more in the future because they can really, try to, at an early stage, select between those who are acutely ill, those who are at risk of a pandemic like this. So I work a lot with them and have attended in their webinars, and we are looking for how we can strengthen the healthcare system in the future with their help as well.
And what is your sense of where we go for these doctors? They were not really ready. They were not given enough help and information, in my opinion.
I think they were, in many cases, they were ready, but since they are not seen as emergency doctors, they were not sort of included in the first stage. And I think this is again what I'm sort of the story I'm telling on the basis of our survey, is that it was not really a focus on the chronic diseases in the beginning. Naturally, we focused on the virus and those people who got the virus, and the virus sort of part of the disease. While these doctors are so important, of course, for also infectious diseases, but especially when it comes to non-communicable diseases.
And what is your advice to anyone who's listening who has a doctor who they feel is not ready and they need advice? What can they do?
So I think it's every person's own responsibility as well. When you feel ill, you have to try to seek help. I know that in many countries now it's very difficult, but try the best you can to sort of keep to your family doctor if you have one, or try to find, the advice. And if you need to go to the hospital, you should go to the hospital. So it's very important, and I think you can trust healthcare workers all over the world. They are really investing in your health. So continue to keep the relationship with the health system and the healthcare personnel.
Because that is obviously so important for people to do, and they don't always understand that, and that's part of the adventure. Before I let you go, I wanted to just show you that my connection to WHO goes back sometime to 1994. I was at the UN, had a big conference on family plan. I think it was about population and population issues in Egypt. And I did this interview. I can just go to the side here. And that is the former chief of WHO, Dr. Nakajima. And in 1994, you can see I had a lot of hair then, Dr. Bente.
How nice. Really nice memory, right?
Yeah. You can also lean over, doctor, on the side, the other side. There you go. There you go. I can say hello. And with that, I want to say just thank you so much for your time and your energy, and your outlook is I feel more optimistic talking to you because I have better information. Doesn't mean that the outlook is different, but we all need to work together. And Dr. Bente Mikkelsen has been a fabulous leader in this field and also helping us today. Thank you very much, Doctor.
Thank you very much. Thank
Bye-bye.
you for what you're doing. Bye.
Bye-bye. And wasn't that amazing? A conversation with WHO's head of chronic diseases, non-communicable diseases, as they call it, at the World Health Organization, live from Geneva, our fifth episode with the World Health Organization, and our 200th episode overall. I cannot believe it. I am kind of stunned that we are here. We're able to do it only because of our sponsors, because of our viewers, because of our awesome producers in Rose Horowitz and Vandana Menon. Please follow them at Rose Horowitz 31 and at Vandana Menon. Tomorrow we have a busy show as well. We are going to be talking to Michael Schmidt, who is a newsbreaker at the New York Times, and his new book, best-selling author of Donald Trump versus the United States, Inside the Struggle to Stop a President. Please check that out. That is coming out on Sunday. The show will be on Sunday. We also want to tell you that I'm hosting a Reinvent Your Job Search, tips for finding and landing your next gig. I'm hosting this with 4 terrific speakers. That's coming up next Friday, October 2nd from 3 to 5 p.m. Eastern. Please join us if you can. It's going to be a very important discussion, and you can find the link at digimentors.link/job search workshop. You can see in orange at the bottom. Take a photo of this and please share it with friends around the world about how to land your next job. We know you'll find this helpful. I'll also be tweeting that in just a moment so you can find it. And lastly, before we go, one of the things we always do is to say their names. We asked Kimberly Crenshaw of the African American Policy Forum, what can we do to support African American people at the middle of this crisis? And she had a simple suggestion. She said, say their name. So we're going to do that right now. We start with this cover of Time magazine that many of you saw. On the left, a painting by Titus Kaffer. You see the words along the border. Those are the names that they wrote, victims of police brutality. On the right is a photo of a young Larcinia Floyd with her son George Floyd. She would die 2 years almost to the day that he would be killed on camera in Minneapolis. They are now buried together in Houston. And in one of the things we talk about, the African-American community suffering worse healthcare outcomes on a regular basis because of chronic diseases. And then on top of that, we had COVID-19 intersect. And now we will say their names. Thank you for joining me in saying their names. Trayvon Martin, Yvette Smith, Eric Garner, Michael Brown, Laquan McDonald, Tanisha Anderson, Akai Gurley, Tamir Rice, Jerame Reed, Natasha McKenna, Eric Harris, Walter Scott, Freddie Gray. I'm going to pause there and tell you that Walter Scott's story was broken by Michael Schmidt, who will be our guest at 9 p.m. on Sunday night. But I also want to tell you that you know the name Freddie Gray, you know the name Walter Scott, Trayvon Martin, but you know Tamir Rice. And it's a tragedy that you know their names and their stories, but it's also a tragedy that you don't know most of these names. William Chapman, Sandra Bland, Darius Stewart, Samuel DuBose, Janet Wilson, Kaylin Rockmore, Alton Sterling, Philando Castile, Joseph Mann, Terrence Crutcher, Chad Robertson, Jordan Edwards, Aaron Bailey, Stefan Clark, Danny Ray Thomas, Antoine Rose, Botham Jean, Tatiana Jefferson, Michael Dean, Ahmaud Arbery, Breonna Taylor, and George Floyd. All of these names are not just names, they're people who had loves, lives, and stories. And we will do all we can to bring attention to that inequality in this country and beyond. Thank you so much for being here. Thank you for being on this journey with me for 200 days with Vandana and with Rose. I'm so grateful to all of you. My email address is right here. If we can work on something, if we can find ways to get more people to more people's stories, get them attention. Of course, the WHO has plenty of attention, but we want that access to be able to talk to folks like them. But there are people who get not enough attention. So send us ideas for guest speakers, themes, sponsors. We're happy to hear from everybody. Thank you very much. I'm so humbled and so grateful to everybody who's been with us these 200 days, especially today to Dr. Bente Mikkelsen. I learned so much, and I know you did too. Just tag a friend right now. Just hit share right now, and they can watch it, because as soon as I'm off the air, the show will replay for everybody to see. Thanks very much, everybody.